At the beginning of the COVID pandemic, certainly in Ontario, as we were looking overseas and seeing the impacts in Italy, for example, and then a little closer to home in New York, there was a lot of confusion and fear and lack of understanding as to what COVID would look like domestically. Lieutenant Colonel James Stalker from 32 Canadian Brigade Group, and I was the commanding officer of Territorial Battle Group 1, which was a rapid response element tasked to respond in the early phases of Ontario's COVID pandemic. So the CAF prepared really a general response under Operation Laser, which is the CAF's pandemic response contingency plan. And part of that response saw the mobilization of thousands of reservists across the province of Ontario and the formation of Territorial Battle Group 1, which was a rapid response force, a composite force, composed of primarily reservists, but some regular force personnel from all across Ontario. That element was tasked to essentially stage and isolate in Borden and be prepared to respond to either a COVID emergency or some other domestic response emergency across the province. Keep in mind this was April, and so we were into the peak flood and forest fire season. And the history of Ontario's domestic response says that quite likely there's a flood or a forest fire response required in the springtime. We formed in Borden really as a general purpose organization. We were heavy with vehicles, communications gear, general problem solving capabilities, crisis response capabilities. It was really only later that the task kind of became a little more clear. COVID's impact on long-term care became clear, and that impact saw a very high fatality rate, a high illness rate, and a high staff infection rate leading to staffing crises in long-term care facilities. And so it was a few weeks into our deployment in Borden that we shifted gears away from preparing for a flood or a forest fire response in a community that was dealing with COVID, and really started to zero in on the likelihood of a response to some of Ontario's most stressed long-term care facilities. In the end, that turned out to be first 5, then 7 LTCFs in the Greater Toronto Area. The RFA was initiated by the province, and particularly kind of coming out of the Ministries of Health and Long-Term Care, up to the federal government, which then authorizes a federal response, in this case a CAF response. And the response was really designed to assist those ministries, to assist the existing staffs in those LTCFs, both for medical support, to support the nurses and care workers in those facilities, but also for generalist support, to assist with things like cleaning, with things like food delivery, with things like maintenance of effects, maintenance of grounds, disinfection. Those were things these facilities were struggling with because, as mentioned, the staff infection rate was so high. When we deployed into these facilities, it's with these task-tailored teams into each facility, composed of about 50 personnel, a mix of medical personnel, nurses and med techs, and generalists. And the generalists were regular reservists, folks from across Ontario providing 24/7 support, again, really in assistance as a backstop to the existing facility staff. And that was really the goal, was to get the home back to just a basic standard and then to hand this back to the civilian providers, because after all, the CAF is a force of last resort only when it comes to this sort of emergency. As mentioned, we were a composite unit, so the initial big bill was taking in all these disparate groups of disparate personnel from all these units across Ontario and forming and training them into a cohesive whole that was capable of responding. Then later conducting recce's of the long-term care facilities to ensure that we had the right sort of force package, the right number of medical personnel and generalists, deploying into those facilities, ensuring that work was being done to remediate and bring them back to a standard at which the CAF could safely divest itself, could safely say, this is now back to the civilian providers. Ultimately, as the tasks reduced, recalling the unit back to home stations and ultimately disbanding in July. Long-term care is not really in our traditional bailiwick. You talk to CAF, even medical personnel, and traditionally those are folks who are working in a field ambulance or field hospital, or they're working as part of a base clinic. None of those are really necessarily a natural fit for long-term care. So there was a lot of learning on our part as military folks were kind of used to taking charge and making decisions. And in this case, we were very much in support of and a backup to the existing home staff. And so integrating into their chain of command, integrating into their model, and providing that service on a 24/7 basis, while kind of in a rush to do so, those were kind of the immediate challenges that the team faced. When soldiers deploy on an overseas mission, there's obviously a natural bit of apprehension or fear for your own safety or the safety of your teammates, but you're pretty sure your family and friends domestically are safe and sound. And in this case, especially in the early days of COVID, there wasn't a whole lot of understanding as to how deadly this disease would be. And so I know a lot of the folks who were deploying in these homes had a bit of a weather eye back home just to ensure their family and friends were safe. And so that was obviously a bit of a psychological stressor for the team. For TBG-1, The total length of deployment away from home was nearly 4 months, and the actual number of days we were in direct support of homes was well over 2 months. The lesson learned was the strength and resilience of Canada and Canadians, but also of our CAF personnel. I mean, these were folks put under tremendous strain, and they responded in a remarkable way without flagging and trying to be where Canada and Canadians needed them to be. And I think that kind of response to a tragedy is really an antidote for pessimism. A little more practically, the CAF teaches general problem solving. And what I mean by that is, we don't know the solution to every problem. There's a lot of unknown problems or new problems, but the idea is we have a very formal planning process. You plug expert advice into that planning process. I know certainly for me, I've never dealt with long-term care. That certainly wasn't part of my basic training, but the team responded in a really remarkable way and was able to apply that general planning process and to get those effects where Ontarians needed them the most. Canadians should know that the CAF is there for them in their hour of need. We really saw that from all the soldiers, sailors and aviators of TBG-1, was that real desire to serve. And I found that salutary, and I found that something that I really look up to.